Hey guys, so let's talk while I do my makeup. And we're going to talk about men's health. This is specifically for my men between the ages of 45 and 55. I need you to listen up. So, I have worked in just about every sector of healthcare, like literally every sector. And when I worked in rehab, acute rehab, I saw so many patients, male patients, between the ages of 45 and 55 who had had a CVA, which is a stroke. And I knew instantly before going through their records, it was from two things: uncontrolled diabetes or hypertension. And we're not talking, little strokes. We're talking major strokes. Like for real, like major strokes. And where they have deficits on either the right or left side of the body. It's crazy for me to automatically think when I would get a patient that, had a stroke and needing aggressive therapy to automatically say it's from two things: uncontrolled diabetes or uncontrolled blood pressure before even looking at their chart. But we're going to talk about it. Men don't take their health serious. They don't. And this is not going to say every man is like this, but majority of y'all don't take your health serious. You will get the diagnoses of high blood pressure, and you won't take the medication. Or you'll take the medication, but you're not consistent and you don't change your diet. You'll also get the diagnoses of being pre-diabetic or diabetes, but have take your insulin. Have take it. Why is that? Let's talk. I'm gonna live in truth. You know why you don't take your medications? Because it affects your stamina. You can't perform when you're on a whole bunch of blood pressure medication and diabetes medication. But you won't change your diet, nor will you comply with taking your medications like you should. And then be around here stroking because you can't perform. Not only is that the reason, that's the reason as well. That's not the only reason. Not only are you not able to perform, but you're not changing your diet. You're not willing to stop smoking. You're not willing to stop drinking. As if you're invincible of the body shutting down. A stroke doesn't care who it attacks. It only cares and reacts to how you choose to take care of your body. It doesn't care. But a lot of you feel as though you're invincible from it. You don't feel like it could happen to me. Yeah, I can skip my blood pressure meds from time to time. I don't have to take this insulin today. I can skip it this time. Or I can still eat however I choose to eat because I'm taking the medication. I don't need to change my diet. Yeah, I don't need to do any of those things. I can continue to live how I want to live. But baby, I'm about to tell you, men, you don't want to have to recover from a stroke. In 2026, let's normalize you guys going to the doctor and being compliant with your medications and changing your diet. Let's normalize that. If you want your libido back, go to the doctor on a regular basis. Get your physicals. Be compliant with your medications. Now, if you're on like 5 different blood pressure medications or more, That is not a hereditary thing. No. Mm-mm. That's a poor diet and lifestyle management. You don't have to get control of it. Life will get control of it for you. And the one thing that you enjoy the most, you won't have to worry about it. Because guess what? It definitely is not going to work. Now, due to your lack of accountability and taking responsibility for your health, you have now become a burden to your wife or family member. Is that fair? Let's normalize going to the doctor and getting our physicals. Let's normalize and proper medication management and taking our meds. Let's also normalize being healthier and taking accountability for our appointments as wives, girlfriends, whoever, whatever role you women play in these men's lives. It is not your job to take on their health concerns. Men, I need you guys to be a little bit more responsible and accountable for your health. It's time to put down the hookah and whatever else, the drinking, the partying, and take care of yourselves. We're getting older. We've only been given this body once. Okay? And you got to take care of it. All right? So, like I said in the beginning, you don't have to be compliant. I promise you, the stroke will make you sit down. All right, I'll talk to you guys later.